Hi everyone, my name is Satara Moment. I am going to present my analysis on the performance of Sentara Northern Virginia Medical Center's quality measure reports. This presentation is prepared as a part of the case study project for the class of HAP 725, which is Statistical Process Improvement taught by Dr. Maria Urio at George Mason University for spring of 2020. In this project, I used the X-bar control charts to analyze the Snvmc's performance on the quality measures based on the 6 domains of healthcare quality from AHRQ sites, which are safety, effectiveness, patient-centered, timely, and efficiency. The data source for this project is from data.medicare.gov Hospital Compare Datasets archive. There are some limitations in this case study. For example, although there are numerous measures to compare the hospital's performances with each other, only 5 measures were selected for this project. Another important fact is that some facilities don't report or collect data, or some quality measures are actually discontinued. Finally, the selected population of patients visiting each hospital might not be similar to each other to begin with, meaning we cannot determine which patients were actually sicker in each hospital. Listed here are the directed competitors for Northern Virginia Medical Center Hospital. These hospitals include Mary Washington Hospital, Nowan Health Prince William Medical Center, Inowa Fairfax Hospital, and Stafford Hospital. These hospitals are selected based on the size, geographic location, and similar type of services they provide in Northern Virginia area. Listed here are the specific quality measures as a part of Northern Virginia's quality and patient safety program, which includes OP18B, which is the average ER care time before the admission, PSI 13 post-sepsis, which is the bloodstream infection after the surgery, MOR13 AMI, which is the mortality rate for the heart attack patients, MSPB1, which is the medical hospital and spending per patient, and OP18 to 14, which is the outpatient imaging efficiency. The first control chart shows the average time the patient arrives at the emergency department, receives healthcare services till the patient gets admitted as inpatient in the hospital, meaning the time limit patient waits in the emergency room comparing to other competitor hospitals. As we see, Northern Virginia Medical Center started to be within its control limits. However, their emergency time waiting increased where in 2015, July 2015, they went above the upper control limit, which is not a good indicator, meaning patients are waiting in the emergency room longer than other competitor hospital. After that, we see that it's gradually the wait time decreased and then being at its lowest point in July 2016. So moving further till the latest time, which is November of 2018, they are still within their control limits comparing to other major hospitals. The next control chart shows Northern Virginia Medical Center's post-operative bloodstream infection rate. This is an important measure since it affects the patient's recovery time after the surgery. We observe here the score for Northern Virginia was above the upper control limit between the period of 2013 and 15. However, after that, the hospital performance improved tremendously, being close to the lower control limits, where between the period of 2015 and 17, they are at the lower, closer to the lower control limits comparing to the other competitors. In the recent years, they still were able to maintain their low score, although they are not at their lower point, but their performance is still within the control limits. This control chart shows the mortality rate for AMI or patients with heart attack. Mortality rates are important since they indicate the effectiveness of the care, therefore they are preventing extra healthcare costs. As we observe here, Northern Virginia Medical Center's score was above the upper control limit between the period of 2013 and 16. However, after that, the hospital improved their performance, and as we see, they are doing really well, and their performance score is toward the lower control limit between the period of 2015 and 18 comparing to other competitors in the area. The next control chart shows the Medicare hospital spending per patient beneficiaries. This is an important measure since it shows whether Medicare spends more, less, or about the same for an episode of care at a specific hospital comparing to other competitors. Meaning, the lower the score, the better the performance of the hospital. If we look at this chart, we will observe that Northern Virginia Medical Center score was always close to the lower control limit in a point where between the period of 2014 to 2017, their score actually was below the control limit comparing to other major competitors in the area. In the final control chart, we are looking at the efficiency in using the diagnostic imaging. This measure was created by the CMS to check for appropriateness and effectiveness of use of imaging in the clinical settings. Medicare spends billions annually on outpatient imaging. Unfortunately, Northern Virginia Medical Center score is above the control limits for this measure comparing to their competitors. The hospital needs to monitor and look closely to its imaging usage to improve their performance comparing to the other hospitals. Specifically, they can look between the period of 2013 and 2014, where they were doing really well and their score was within its limit. In conclusion, Northern Virginia Medical Center's performance score is within its limits for 4 out of 5 of the analyzed measures. They have lower average ER waiting time. They have lower bloodstream infection rate. They have lower mortality rate for AMI patients. And their Medicare spending per patient beneficiary is lower. However, when it comes to outpatient imaging efficiency, they need to improve their performance. This concludes my presentation, and thank you for listening.